You won't count that against my 20 minutes, right? The 10 seconds of clapping. But what's been amazing, actually, in what they've done is that they actually lowered the podium for those of us who are vertically impaired, like me and Jamie and Nico. So I'm sure all of us are very appreciative of that. So I'd like to start with just acknowledging my partners in crime who have been incredible collaborators for some of the things I'm going to be presenting today. And I have two objectives for my presentation. One is to discuss some of the current trends in information technology that I think hold particular promise for physical activity promotion, and the second is to really highlight some future directions in the field. So the challenge really is technology. We love it, we hate it, right? We can't live without it. Some of my favorite things like microwaves are technology. However, we know that technology has really engineered regular movement, as Jim and other people have talked about, out of our daily lives. And so how can we really harness technology for good in terms of the physical activity area? And is there a solution in all of this technology? Some of us are even looking at it right now. I can see out in the audience our mobile phones and our smartphones and our computers. So what does technology do for us? We know that it captures real-time information. That's fantastic. The first time in our lives when we can get to that kind of contextualization. It delivers personalized, contextually relevant messages and information, and it has extraordinary population reach and impact. And that's incredible. For instance, we know that there's been an explosion of mobile devices around the world, and in fact, there's as many mobile phone subscriptions as people in the world currently, and there's actually a growing number of countries that actually have more cell phones than people. And what's nice about this trend is that we're seeing it in every country around the world, regardless of economic development. However, while its potential is vast, it's really a wild west out there. We really know very little about the efficacy of these programs and which programs might work best for you and which might work best for the person sitting next to you. And really, I think one of the things we're all grappling with is that traditional science is really too slow. It's really not agile enough to capture current trends and innovation. So what are we going to do about this? How are we going to study this? Well, I'd like to throw out one possibility, and that's what we have been calling community-engaged citizen science, that really brings together researchers, public and private organizations, and the residents themselves to really harness this incredible, big, hairy physical activity promotion challenge that we're faced with, and that's only going to get worse, as Jim has laid out so beautifully in his discussion. So we can apply this kind of approach to two different IT domains that I'm going to be focusing on today. One is the me domain. The other is the we domain. So in terms of the me domain, how many people are part of the quantified self movement? In other words, you are sensing and tracking your physical activity. Let's see, bigger hands, a little more exercise. Okay, so most of you are doing this. So this is an incredible opportunity. We have hundreds of thousands of literally N of 1 individual experiments that are occurring across the population at large, involving people getting just-in-time sensing of a growing number of physical activity-related as well as health-related data points throughout the day, the week, the month, and it's being pushed to the cloud. And this idea of how can we capture this for good, I think, is an incredible challenge that could really be a game changer for us in this field. Right now, there are data hubs in the public and private sectors that are emerging to really combine and make sense of all of these data. And there are significant opportunities I think, in physical activity and other arenas through partnering with industry to really help us capture this. And this is happening, and it's going to be happening more, and I think we really need to embrace ways that researchers and public sector can partner with the private sector around some of these issues. Now, in addition to quantification and assessment, one of my favorite things is really harnessing the power of this information for personalized IT advising. And I'm just going to share with you a few things that are going on. Telehealth, virtual advisors, and smartphone apps. Lucky for us, there is about 60 years worth of evidence-based behavioral strategies that we know work across communication channels. So whatever communication channel you choose, there are proven strategies that will help people change their behavior, and here are some listed here on this slide. So in terms of telehealth by computer, one of the major questions has been, can automated systems actually replace human advisors in promoting regular physical activity? So think about how your reservations were made to fly here or come here. Some of you may have used reservation agents by phone. So these are oftentimes now automated interactive voice response systems. So picture that when you see the next data slide. I'm like this with the United reservation agent. I speak with him every week. He knows everything about me. He greets me by name. So that's what I'm talking about. So we have found in one of our trials that, in fact, there was no difference between phone advice delivered by humans or phone advice delivered by one of these human-sounding automated advisors, which lasted across 18 months. Now, when we asked people at the beginning of the study, what would you prefer, a human or an automated advisor, and we let them listen to the automated advisor, 85% to 90% said, I need a human. I absolutely need a human to help me. In fact, the data show that's not the case. We have to be very careful about preferences because people will automatically tend to prefer what they know, which may not be the best thing for them in the long run. Now, we're taking this thing to scale, hopefully. The NHLBI has funded us to do a pragmatic trial with about 20,000 women who have been participating in the Women's Health Initiative and offer them these kinds of interactive voice response advisors to increase their physical activity. So another side to personalized technology, and Jim touched on this in his talk, is this issue of preventing the widening of the health disparities gap. And we know this is due to the fact of language issues, reading levels, problems with computer access and skills, and health literacy. And so there's been a movement to develop virtual advisors that can provide tailored interactions through simple, very simple verbal and nonverbal conversations. So I want to introduce you to our virtual advisor. This is Carmen, so I'd like you to say, Hola, Carmen. Let me hear it.
Hola.
Hola, Carmen. So Carmen is a culturally adapted, bilingual advisor, and you interact with her with simply touching the screen on the monitor. There is no keyboard, there is no mouse. Carmen is a development of our group in collaboration with Tim Bickmore and his colleagues at Northeastern. So here is one of our participants down in East San Jose. She's in a community center there, and she's having an advising conversation with Carmen. Carmen is advising her about her walking program and how she can become more active. Now, Carmen's shown herself to be incredibly good at being able to increase walking minutes in Latino older adults, and these are older adults who had never touched a computer before they started using Carmen. And in fact, similar to what that slide showed, we also found that their pedometer steps pretty much mirrored what was going on in terms of their self-reports of physical activity. So we were very, very excited about this. And at 4 months, we asked people what it was like to work with Carmen. And what these participants told us was that Carmen really cared about them. And they felt that they felt close to Carmen, they trusted Carmen, and they were very interested in working with Carmen. And in fact, they did so over the next 5 months after the research ended, because when our research ended, the NCI had given us so much money and then it stopped. And we went to take Carmen out of the community centers, and the participants said, no, you cannot remove Carmen. You need to leave Carmen with us. And so we went ahead and we left the computer with Carmen in the community center. It became a natural experiment, just watching. And 95% of those participants continued to talk with Carmen over the next 5-month period. So I think the next step for these kinds of virtual advisors is to really scale them up, try them out in more kinds of community settings with different kinds of populations. And right now we're running a trial where we're pitting Carmen against human advisors in the Latino community in and around the San Francisco Bay Area. But you can imagine these kinds of virtual advisors in a number of different settings. Just think about where people tend to have to wait, or where they congregate, or where lower income individuals may go, and all of those would be ripe settings for Carmen. So in terms of smartphone applications, we know they're everywhere. They have incredible potential in terms of passive assessment of physical activity, giving just-in-time feedback, but few really employ other types of theoretically or empirically based strategies to really enhance motivation and behavior over time. It really is the Wild West out there. So we've been playing around with developing smartphone apps for walking more and sitting less, and I want you to think about which motivational frame you might choose. So the analytic frame is one that's the facts and figures, just the facts, ma'am, give me the data, and you can see how you're doing throughout the day on your wallpaper, so it's an active interface. The second one is the Affect Play app. It has absolutely no numbers, no figures. It's a little birdie avatar who reflects how you're doing during the day. And if you're doing great, the birdie is chipper and cheery, sort of like Jim, and flies really fast and walks around a lot. And if you're not, you're a little depressed, sort of like the other Jim who's sitting there. And then there's a social app where you get your feedback, but it's continuously within a group format, a virtual team in terms of your team versus another team. So what we have found is that all three of these apps have been able to increase physical activity and sitting less in a variety of populations. We like to work with people who've never touched technology, so this is the kind of population here. They've never had smartphone contact before, and when we put them head-to-head in an experiment, we actually found a couple of things. First of all, in terms of the physical activity part of it, the social app overall did the best, but what was interesting was the other two apps that was more variable in terms of how people did, but some people loved those other apps and some people hated them. So the real question is not, do these apps work? The question is which apps for whom? Now, in sedentary time, it was a different story. A different app sort of rose to the top, the analytic app that gave a lot more specific information around sitting time. That was the app. So perhaps different kinds of behaviors that we care about need different kinds of motivational frames. Now, what does the future hold? So picture the future. Technology, hopefully, that informs and motivates but gets out of the way of active living. And I suggest that what this means is right now we're all looking at the world through a screen, just like you are, right? You go to any kind of big picture, and I remember Apple had this incredible commercial until I started thinking about it, where someone's running and there's beautiful music and they're running in front of mountains and they're running in front of rivers, and it's very inspirational until you realize that the whole world has been reduced to the person's screen. And I think what we're going to see is we're going to see screens go away. And I would predict within 5 to 8 years, given what's happening in Silicon Valley, you're not going to see screens anymore. You're going to be wearing everything, from iWatches to Google Glass to everything else. It's going to be a huge shift, I think, away from screens, and I think that could be freeing in terms of physical activity and active living. So going up a level to the we domain, empowering citizen scientists to assess and advocate for healthier neighborhoods and social environments. I'll just talk a little bit about that. In terms of citizen science projects, we've been aiming to develop simple technologies to help low-income, underserved residents identify neighborhood features that help or hinder active living and healthy eating. They prioritize issues together, build partnerships, and advocate for change. So think about what Jim was talking about with his Maps Mini thing, which is great. It's researcher-driven. This is what happens when you give these technologies to residents and you empower them to capture the kind of information that's important to active living. So here is our technology. It's a very simple electronic tablet. It captures barriers to walking and food access. Residents walk around their neighborhood. They can take geocoded photos and actually narrate the problems that they see in their neighborhood. We then put these things together in an aggregated view for policymakers, crowdsourcing, if you will, so people can actually see, the whole community can see what's going on in this neighborhood in the residents' own voices. So we started this out in East Palo Alto, one of the poorest communities in the San Francisco Bay Area. Residents did a great job of using it to identify issues with traffic crossings and public transit paths, and were able to come up with solutions. And in fact, they did such a good job. These older residents, most of them, they were seniors, most of them were African American, had never touched technology before, went to the city council. We helped them with PowerPoint. They figured that out. They presented to the city council. The city council turned around in this very poor community and allocated about $400,000 for needed citywide sidewalk repairs, as well as other things to facilitate walking. So we have taken this model on the road and I'll just show you a few examples. We've used it for increasing food access among low-income residents. We have used it for intergenerational solutions. When you give it to teens or preteens and their seniors, their grandparents and their parents, it's an incredible synergy when you bring these different generations together to talk about their perspectives on their neighborhoods. We're doing it in Mexico. And two things are the major issues in Mexico: sidewalks, stray dogs, which we heard yesterday. And not just stray dogs, but the little gifts that stray dogs leave behind on the paths were things. And so Mexico is working on coalition building among neighborhoods to figure out ways to change that. We're doing it in Israel with Israeli, Arab, and Jewish residents for the first time coming together to talk about neighborhood barriers that they all share. And what's interesting about Israel was that it wasn't just stray dogs there, it's actually stray pigs in Israel. Same concept, different species, but the same idea. We've been doing it in Bogota for the ciclovías that people have been talking about to see how those can be improved, and also in rural areas, because we know rural areas are different. So our goal, our dream, is to build a network of community-engaged citizen science around the world, and this is just some of the places that we've either done these kinds of projects or we are developing projects. So another side to social environments has to do with harnessing social networks. And through processes like homophily, where you look for perceived similarities between people, and with those perceived similarities you get social modeling, I think the field is really ripe for us studying more intensively the spread of physical activity via social networks. There's so little that's been done on that right now. I think that would be incredible. So in summary, some thoughts about what we can do. I think we need to harness the power of intersectoral and intergenerational teams to really push the envelope in this field. Look for opportunities to partner with private sector and community organizational groups. I think we need to figure out and continue to push the envelope to reach all groups to address health disparities. We know the witch's conundrum is alive and well. Which programs for which people is really the major goal. Stealth interventions, where we focus not just on health, but on other motives and values. And then we're going to have to tackle this privacy issue. This is something that came up yesterday, and it has to do with really combining physical activity and dietary change. We're partners, we're synergistic, we're complementary. Let's work together. And finally, in addition to tackling top-down approaches like the great policy work we were hearing this morning, I think we need to think bottom-up as well through citizen science engagement. I'm just going to leave you with one thought, that I think we need to challenge ourselves, get out of our comfort zones by thinking about collaborations with researchers, organizations, and the residents themselves, because we will be better able to meet the challenge of not only anticipating the future, but creating it. Thanks very much.